and welcome to #OurDocTalk. This is NorthBay Healthcare's effort to reach out to the community, answering questions on important health issues. I'm social media and online specialist Robin Miller. With me today are two of our best doctors here at NorthBay, our physician leaders. On your left, it would be your left, is Dr. Edie Zusman, who is Medical Director of NorthBay Center for Neuroscience, and Dr. Christopher Rumery, Medical Director of NorthBay Pain Management. Together, they are coordinators of NorthBay Spine Center, and that program is the focus of today's chat. Thank you both for being here today. So, just a little bit of housekeeping for those who are tuning in. If you have a question, we want you to hit the comment button and type it in. But please be careful about your personal health information. Instead of writing in the first person, I have this, I have that, try third person. I know somebody who has this, or what if a person has this? And that'll help us protect your personal health information. So thank you both for being here. Let's start with some basic questions, big picture questions to sort of set the scene. Dr. Zusman, in layman's terms, can you tell us what neuroscience is and what type of health issues you see here at the center?
So the NorthBay Center for Neuroscience is a collaborative center that includes neurology and neurosurgery. Neurology emphasizes the non-operative management of diseases like headaches, multiple sclerosis, weakness in the arms and legs. Neurosurgery is the surgical treatment of neurologic disease, and one of the things we're incredibly proud of here at NorthBay is our work in care of patients with back and neck problems.
Great. And Dr. Rumery, same kind of thing for you. Please explain pain management and how it's not just take a pill and see me in 3 days.
Well, when we see a patient in pain management, frequently they come in with a symptom, low back pain, neck pain, and it's our job to determine the cause of their pain so that we can treat it most effectively. So frequently that starts with imaging studies, depending on the type of pain that they have, and they're frequently referred to physical therapy as a first step. We also send patients to our colleagues in osteopathic manipulation medicine with soft tissue manipulation, which can be very effective in decreasing pain. There are multiple pain medications that can be tried. We do injections or nerve blocks for patients depending on their location of their pain.
Somebody has already posted a question, and it's initials, POTS. Do you know what that means?
Oh,
Any
no.
idea? That's not? Okay, maybe they're just, maybe you can be more clear about your question, Melissa, and then we can pass it along.
Acronym POTS.
Can you give us an overview of the spine program here at NorthBay?
One of the things that NorthBay offers that's different from anywhere else in Northern California is an integrated program where pain management works together with OMM, with neurosurgery, and with physical therapy all together in our spine clinic, which is located in the Vacaville Wellness Center. And at NorthBay, what we're able to do is we're able to take care of all of patients through the whole continuum of care. From somebody who maybe injured their back playing basketball on the weekend to somebody who had an injury in the workplace, all the way to somebody who has degenerative spine disorders, spinal cord tumors, spinal cord compression, sciatica, and scoliosis. So one of the things that we're particularly proud of is our focus on working together to determine what's right, what's the best plan of care for a patient. And if that includes physical therapy and water therapy, then we have the 50,000 square foot wellness center with a track, with 4 swimming pools to be able to look at optimized non-operative management. If that's a patient who needs complex, state-of-the-art, either minimally invasive or open spine surgery, then at NorthBay we have state-of-the-art care with intraoperative CT scanning, $500,000 microscope, and incredibly well-trained surgeons with expertise through the continuum of care.
And so you're working closely with all of those doctors on each patient?
Yes, ma'am.
Okay, so every patient may not necessarily need some of it, but you're still going to do a consult and look at everything.
Correct.
That's wonderful. Now, I also want to clarify something. You know, when we start talking about the spine, doctors talk in letters and numbers. Your L5, your C this, your... Please explain the spine kind of briefly to us.
Well, in the spine, there are all the bones in the neck, and then the thoracic spine and the lumbar spine, and in between each of those bones is a nerve root. And in the cervical spine, the neck, we call those labeled C for cervical, meaning neck, and those are numbered 1 through 8. And then in the thoracic spine, we have our T nerve roots, and those are numbered T1 through T12. And then in the lumbar spine, we go lumbar 1 through lumbar 5. And they all come out at different areas in the bones. So we know, depending upon where the pain is in your arms or legs, we can predict where we're going to find some structural compression on our imaging studies.
We had a question submitted in advance by a person who asked about someone they know who had spine surgery. They had their L1 through L5 fused, and now they walk with a hunch, and they're wondering if that's normal, if there's something that can be done to it, and, you know, any recommendations.
I think that's a really important question. You know, to me, that's the perfect type of patient for Dr. Rumery and myself to evaluate and see together with our physical therapists. Sometimes it can be something that's, you know, that's musculoskeletal, where we can do some coaching and training and help with some of the alignment. Every now and again, it's actually the way the spine fusion settled, and depending upon the curve of the spine with the fusion, there can be times where there's some compensation. And due to discomfort or due to the alignment of the spine, we see somebody lean forward to compensate for that. So that's a wonderful patient for us to consider.
And also, you were explaining the bones of the spine. Can you explain to us what is a disc?
I'm going to turn that one over to my partner.
So a disc, I explain to patients, I think the best way for us to think about that is that it's a shock, it's like a shock absorber, an anatomical shock absorber. And it allows movement between the different, at each level between the bones. And normally we're not very aware of that until there's a problem. And if the disc bulges or herniates, it can press one of those nerve roots that Dr. Zusman was just talking about. And then wherever that nerve goes, generally to the down the arm or down the leg, you can get referred pain from the back to that area.
Okay. And what are some of the problems that can happen with a disc? They call it herniated. What does that mean?
I mean, if you think of the disc kind of like I think of it kind of like a donut. And there's a nucleus, and then around that nucleus is a fibrous ring, and sometimes there can be damage to that fibrous ring that can allow the inside of the disc to bulge out and then press on the nerve.
Okay.
And from my perspective, a lot of those words mean the same thing. So some of the terms you might hear for yourself or your friends or family, you might hear something called a prolapsed disc. You might hear a herniated disc, an extruded disc, a disc fragment, a compressed disc, and the key there is, do you have back pain, or do you have pain that's going off into the arms or legs? And depending upon which of those you have, then we evaluate the disc differently.
And there are nerves running through there that can be compressed and injured, right? And how do you know what's happening? How is a back problem diagnosed?
That's a great question.
Well, I'll take that. So I think Dr. Zusman is exactly right. So the first thing to determine if somebody presents with back pain is, do they have isolated back pain or do they have back and leg pain? And generally, back and leg pain would be caused by a herniated or bulging disc pressing on the nerve root. If they have isolated back pain, it can be caused, it can just be muscular in origin. That would be the most benign reason for back pain. So we call that myofascial pain, that would be treated with physical therapy, light exercise, stretching, heat. Osteopathic manipulation medicine is also excellent for that. If it doesn't respond to that, then it's very likely due to arthritis in the lumbar facet joints, which are where the bones in the back join posteriorly or closer to your back that surround the spinal cord. And at every level where there's a nerve, there's also a joint, small joint about the size of your little finger. And those can become arthritic. It's very common with age, and we test that by blocking the nerves that go to those joints. It's a very simple procedure. Those nerves, if we find, are the source. If the joint is found to be the source of the pain, there's a procedure we can do where we heat the nerves up, and generally gives a year of pain relief, and then that can be repeated.
And that's called ablation? Is that
That's
right?
called, we use radio frequency energy. It heats the nerves up. It causes the tissue to vibrate 500,000 cycles a second.
Wow.
So that's, AM radio starts at 540 hertz, and this is at 500 hertz. So it causes the tissue to heat up, and we generally heat the nerve up to 85 degrees centigrade for 90 seconds, and it gives us a very small controlled burn pattern that damages the nerve but no other surrounding tissue.
Right. Our follower who was asking the question on POTS says it means postural orthostatic tachycardia syndrome. Have you heard of that?
Well, that would be, it's not exactly a pain situation. So
Okay.
I think that, my understanding of it, this is, in very general terms from an anesthesia standpoint, I'm also an anesthesiologist, it may be when the patient goes from lying down to sitting up.
Is it maybe something more along an orthopedic?
I would say it's more cardiovascular.
Oh, okay.
It's cardiovascular, and it's often related to the sympathetic nervous system. It can be associated with different types of spine conditions, but including things such as Ehlers-Danlos and other types of collagen vascular disorders. But in general, it wouldn't be something that would be a day-to-day part of the care of our spine patients.
Center. Okay.
Mm-hmm.
So can you tell me, what is chronic pain? What does that mean? And how is that diagnosed and treated?
Well, chronic pain generally is pain that lasts more than 3 months, which is different than acute pain. If you have a total knee replacement, we all expect that your knee's going to hurt for some period of time, several weeks usually after the procedure, and then your pain gets better and better and better until hopefully you have no pain. A patient with chronic pain has an injury that that process has been interrupted, and instead of the pain going away, they're left with a chronic condition. And I would say that's the amount of time that you have it is the hallmark of whether it's acute or chronic.
How do you treat it?
Well, I was going to say one of the things that we are dedicated to, Dr. Rumery, whose background is in anesthesia and pain management, and myself as a neurosurgeon with particular interest in spine problems and expertise. One of the things that we've done in designing the NorthBay Spine Center is we've looked at how do we treat acute pain so that it doesn't turn into chronic pain. And I think a lot of you may have heard about what's been going on with the opioid crisis, and some of the reasons folks take opioids and have taken opioids over the years is due to back and neck pain. And so that's a group of patients where we are looking forward to seeing very, very early in their diagnosis, at the time they first get back pain, at the time they first have an injury or an accident or a pulled muscle or a herniated disc. And we feel that if we can have those patients do the right things for their spine and be on the right track to health, that we're hoping that we can decrease the number of patients who go on to develop chronic pain. The definition of chronic pain varies. For some people, it's if it lasts more than 6 months. In our community, it's probably more like 2 years. That would be considered the really significantly impaired chronic pain patients. And I want to say that at NorthBay, we're looking at welcoming both the acute back pain patients and the chronic pain patients. We feel that our multidisciplinary, holistic, team-centered approach is going to help all of those folks get on the right pathway.
Are there certain risk factors to developing back pain and spine problems? And what are those?
And you know, I think that's part of being aware of your own health. We know that if folks are doing a job where they're not using their body correctly, where they're twisting or reaching or doing things in a way that may be continually loading the spine, that those are patients who can get some coaching and guidance on how to do what they're doing safely. We're very aware of ergonomics in the workplace and opportunities to do things in the best way and the safest way.
Anything to add to that?
I think that overall fitness is very important, and that, you know, maintaining your weight via exercise, good nutrition, all those things, I think will help keep your back healthy.
I have somebody who's posting talking about chronic pain being so debilitating that it helps you not be able to function. At what point do you say, I've got to get into a doctor? You know, how do they know that it's gotten to you?
Well, I think that I think that some discomfort is inevitable. I think, suffering, nobody should have to suffer. And so I would urge that person to, find a pain management program for an evaluation to find out, what's going on, find the source of their pain, and so that it can be treated.
They don't have to live in pain, right?
They don't have to live in pain, should not live in pain.
And for Dr. Rumery and myself, our first focus is why. We work with patients to try to understand what their symptom is and see, can we find a surgically correctable or a treatable lesion to try to help really move that parameter and make things better from a structural perspective. And then there are a group of patients where there are other options to treat pain if there's not a surgically correctable lesion that we can identify. And then there are different types of things that we can do in terms of lifestyle, quality of life, medications, other types of therapies. And so to me, I just go to work every day feeling hopeful. I feel like I'm going to be able to find something, and if I work hard enough together with my team, we're going to find that path forward.
That's wonderful. Can you explain what is sciatica? It's one of those things that comes up a lot when people talk about, so my sciatica is bothering me.
There are two words. There are two terms that you'll hear. One is sciatica, and one is radiculopathy. And a radiculopathy is a pinched nerve where you've got some numbness or weakness in the region of that nerve. You already heard that all those nerves are numbered. So when you walk in, we can generally do an examination and get some imaging studies that'll show us exactly which nerve is pinched. So sciatica is like the warning before you get the radiculopathy. Sciatica is just when your back pain turns from back pain into leg pain, and a lot of folks will report to Dr. Rumery or myself. They'll say, it shoots down into their buttock area. Sometimes it'll go down that lateral aspect or the outside of the leg. Sometimes it'll stop at the calf, it'll stop at the ankle, or it'll go right into the foot. And all of those are important. So if you're getting sciatica, you want to write down exactly where the pain goes. Does it happen when you're sitting, standing, walking, laying down? And that's what you'd want to bring to your doctor.
That's good. Do you have other advice on things when they're coming into the spine center? What kind of information should they be prepared to present?
Well, I mean, the things that it's valuable for me to know is, where exactly does it hurt? How long has it hurt? What things have been tried in the past? What they're currently doing? Any previous surgeries or injections? I think those are, kind of the very basic outline of things that patients need to report.
And one of the things that I'm really proud of for the NorthBay Spine Center is the role of neurosurgeons and neurologists in making those diagnoses. So if you're coming in with a symptom and it's unusual, what if it's a hip problem or sacroiliac joint problem or some sort of a tumor or fracture? We feel that because of our focus first on finding out what are your symptoms, we listen, we take notes, we do a neurologic and physical exam, we do appropriate imaging studies and diagnostic evaluations so that we really have a good sense of why you're having that symptom. And then at that point, we work very closely and collaboratively with the doctors who help make that symptom better. And if that requires intervention by our pain team, by our OMM doctors, our physical therapists, our trainers, or the neurosurgeons, then all of those folks are here ready to help make that difference.
Something, if I can just add this, something that I find fantastic that we do here that I haven't done at other places that I've worked is we have what I call spine grand rounds once a month, and so we present challenging patients, and we have one or two neuroradiologists, and we have several neurosurgeons, and we have the pain management doctors, and we may have the osteopathic doctors and physical therapy there to discuss that patient, and we collaborate and come up, all sitting around one table with a plan that then we can offer the patient. And I think it's so beneficial to have everyone's insight, because everybody looks at that problem a little differently.
Now, some people are afraid of both things that you offer, surgeries and meds. They don't want to do either one of those things. Are there options that don't involve surgery or medications?
Yeah, absolutely. And I have to say that our approach is tailored to each individual patient. We also have what we call a conservative approach. We would love to see your body heal on its own without our help in terms of interventions. If it doesn't heal on its own in a defined period of time, or we see the symptoms progressing, that's when we look at these other steps.
Okay. And are there things we can do to prevent getting back problems and spine problems in the first place? I think you talked a little bit about watching your weight.
Yeah, I think body mechanics. I mean, if you're a bull rider or have played professional football or a professional wrestler, because I see occasionally somebody that's done that, you're probably going to have pain, someplace in some joint in your body. Probably doesn't seem like that when you're 20 or 30 that you're ever going to be 50 or 60, but if you're lucky, you reach that.
It's coming sooner than you think.
It's coming sooner than you think. So I think kind of watching your lifestyle, watching your weight, staying fit and healthy, I think are.
And the threshold that I use is when you find that you're not able to do the things in your life that give you joy. If you love playing with your grandkids and you find that you just don't have the ability to do that because of back or neck pain, I think that would be a time to seek help. If you love walking your dog and you find that you're unable to do that because of back or neck pain, then that would be the time where you'd ask your doctor, are there any other options for me?
Okay. How's a person to know if their back pain is serious or something that will pass with hot and cold packs and over-the-counter medications?
I think it's fine to try hot and cold packs and over-the-counter medications. I think it depends on the severity of the pain. I mean, if it's just awful and they're suffering, then I think they should probably, seek some kind of medical advice.
And one last question, can we talk a little bit about the role that OMM and Rehab play in the Spine Center?
Well, it's integral. We feel as though we've built the Spine Center with the pillars of expertise of our OMM, doctors of osteopathy, equally with our trainers and our physical therapists, along with the Neurosurgeon spine surgical team, and our pain management doctors. And we feel that when a patient comes to us, our goal is to talk together and determine what's the best that we can do for each individual patient.
And before we sign off, is there something more you want to tell people? What's the one message you want to make sure gets through to them about the Spine Center?
I think to me, it's when you make that call. It's when you decide to get more help. And if your quality of life is not as joyful, if you find that this is happening recurrent, even if it's starting and stopping, or if you feel as though any of these symptoms are escalating, I think that's when you want to tell your primary doctor and ask for a referral to our center.
Now, if somebody does want to contact the Spine Center, do you have some information on how they can do that?
They could call 707-624-SPINE.
Clever enough. All right. Thank you both for your time today. And this will post on our Facebook page. You can watch it back on Facebook. Our address is facebook.com/NorthBay Healthcare. Thank you for tuning in today to our Doc Talk.